Tonight is our fourth session in this series, and we will explore rural versus urban healthcare disparities, challenges and opportunities for addressing the opioid epidemic in rural Louisiana, practical opioid safety tips, and rural resources for addiction and recovery. We're happy to have Rachel Jackson with us this evening. Rachel serves as program coordinator for the Louisiana Ambulance Alliance, an organization that promotes emergency medical transport as a distinct concern in Louisiana and encourages the development of appropriate health resources across the state, especially in Louisiana's rural communities. The Epidemic LA program works to leverage federal funding to form and support local and rural networks to address the opioid epidemic through collaboration and communication. Rachel, we're looking forward to hearing from you. Thank you for joining us, and I will turn it over to you.
Thank you so much, Mandy, and thank you to Yolanda for inviting me, as well as Heather, who's present with us tonight. And thank you to all of you for joining us this evening. I do want to make sure that you all can hear me okay?
Yes, I believe we're good.
Perfect. So as Mandy mentioned, my name is Rachel. I serve as the program coordinator for the Louisiana Ambulance Alliance, and I am representing our In the Epidemic program here tonight. Within the epidemic, we primarily hope to increase education access for prevention, treatment, and recovery in rural areas, as well as forming multi-sector coalitions and groups and supporting those that already exist to address the opioid epidemic in rural areas. We're going to get a little technical tonight. As Mandy mentioned, we're going to talk about the differences between urban and rural. And I do also just want to give you all a disclaimer and a heads up. I will not be presenting definitive answers or solutions to this issue tonight, but I do have some good information to share. And as we all know, this is a wide-spanning, really complicated issue. I'm hoping that more conversations that we have like this, where we prioritize rural communities, the better our response can be. So I'll ask Mandy to go on to the next slide. And before we get too deep into our discussion tonight, we have to talk about what rural means. And so on the next slide, I do want to begin by kind of designating the differences between urban and rural. Next slide, please. So what does rural mean exactly? In everyday conversation, I think that rural can bring something different to mind for all of us. It is an abstract concept. And for me personally, I think of rows of corn, I think of crops, I think of the countryside. For you, it may be something different. And thus, it can be a difficult task to define exactly what rural means, and even harder to explain it. So for tonight, we are going to be using one particular definition of rural from the US Census Bureau, with the understanding that there are a few other definitions in use by a few other federal agencies, especially the Office of Management and Budget, as well as the US Department of Agriculture, USDA. For many years, the federal government has been classifying areas and their populations for statistical purposes and to figure out where they should direct their funding and their programs. And it should be noted that these are not set in stone. The federal agencies that make these definitions create and use them to facilitate their own programs, because there is no one single definition of rural that works for everyone. There's no clear line that divides rural and urban entities. They all kind of have their strong and weak points. And so each one is used by agencies in ways that best serve their needs. So as I said, for me personally, I think of rows of corn and rows of soybeans. I do want to make this presentation tonight a bit interactive. And so I will stop for a moment and ask you all what comes to mind for you when you think of rural. You can share that in the chat box. And we'll take just a second to think about what rural means to us. So as I said, I'd be curious to know from some of you out there in the audience, what comes to mind when you think of rural? Or if you're able, I'm not really sure, you can also unmute yourself if you're able.
You should be able to, yes.
Nice, thank you, Mandy.
We have one answer in the chat, small towns and villages and countryside.
Yeah, it's about the same for me. As I mentioned, it's rather abstract, right? This word can kind of bring different things to mind for different people. So we're going to get a little technical, but before we do that, on the next slide, I'm going to throw a bit of a curveball at you because first we have to talk about what urban means. So, the way that the Census Bureau thinks and talks about rural depends on the term urban. To fully understand the way that the Census Bureau defines this term, we are going to talk about how they define urban. So, there are two major urban designations from the Census Bureau, there's urban areas and urban clusters. Urbanized areas are areas with 50,000 people or more. Urbanized clusters are areas kind of in between that have at least 2,500 people, but fewer than 50,000 people. I will ask Mandy to click a map because urban clusters was a unfamiliar term for me. It helped to look at a map to see exactly what that means and what that looks like here in Louisiana. And so there are quite a few urban clusters in Louisiana. These are our, I think, towns that we would probably consider to be rural if we didn't know the definitions, but technically they are designated in other ways. So we'll take a look at the map. As I mentioned, this is a map from the Louisiana Department of Transportation and Development.
I'm working on it.
Oh, thank you. Take your time. After we look at this one, we're going to take a few moments to look at a few other maps that are really, I think, illustrate more clearly what the differences are between urban and rural. So as we can see here, Louisiana has quite a few areas that are designated as urban clusters. So as I mentioned, these are the areas that are kind of in the middle, right? In the middle between not quite over 50,000 people, but also not less than 2,500. Near Shreveport, there's Minden, there's Mansfield, even Benton to the north was considered an urban cluster. As you get farther east towards Monroe, there's Ruston, where Louisiana Tech is. There's also Rayville. And I believe that I also saw Jonesboro on this list as well. And so as you can see here, urban clusters are kind of all over our state. And there, just to keep in mind that there is a slight difference between urban clusters and urban areas, which are going to be our bigger cities. So those are going to be your Shreveports, your Baton Rouge, as well as New Orleans and Monroe as well here in Louisiana. And so the next map that we're going to look at is going to be a map from the Census Bureau. And we're going to think about just how much of our country is designated rural. And once we see this map, you'll really get a good understanding of why the Census Bureau designates these things this way and how much of the country is actually considered rural. Next slide, please.
Rachel, are you ready to go back to your presentation now?
Yes, yes, thank you. So the map that we're going to look at is from the Census Bureau, as I mentioned, and we're going to be able to see quite a few areas on it. So let's talk statistics for just a second. About 19.3% of the US population is considered rural currently, but the Census Bureau kind of thinks about this in different ways. There's rural communities, which is how we are thinking about population and people, but there's also rural land area. The census recognizes that densely settled communities outside the boundaries of large incorporated areas are just can't be just as urban as the densely settled population inside those areas. Because of this, their definition does not follow any city or county boundaries. And so it can be difficult sometimes to determine whether a particular area is considered urban or rural. As I mentioned, currently, we don't have the 2020 rural data quite yet from the last census that was taken, but in 2010, we know that about 19.3% of the population is considered rural. They live in rural areas, while more than 95% of the land area is considered rural. If you just take a look at this map here, you can see that most of the land in the country is designated rural. You can see some holes there. I see a big one for Atlanta, a few others in our state that correspond with New Orleans and Baton Rouge. And it's just important to remember that even though these areas are quite large, they just don't have a lot of people in them. And I was really struck by how much of our country and how many states there were that were nearly all rural. So on the next slide, we will look at a different map, and this one is going to talk a little bit more about population rather than land. As we can see here, and according to the legend that is on the right-hand side of your screen, you can see that the darker the color of the area, the more people that are in it. And as you can see, once again, a lot of our country is full of small, rural, designated communities. You can see kind of in Southern California, Southern Arizona, Southern Florida, we have some of our more densely populated areas, but the majority of the country does not have that level of high population. As you can see in the Midwest, and especially the farther west you get in the Northwest, most of those states are going to have really small populations that don't necessarily correspond with the amount of land area that they have. And so we're going to dig a little bit more into Louisiana specifically and talk about some of the specific data for Louisiana on the next slide. And this one is going to show us a good view of the parishes and how those are designated. So here in Louisiana, depending on what source you find, I found about 15% of Louisiana's residents live in rural or non-metro designated areas. Some sources I saw said 16%, but just know that it's about in that area with the data that we have right now. And as we look at the parish population map, we can see that Louisiana is mostly rural. I don't think that's news to a lot of us here on this call. I can imagine that most of us here are probably natives, and so we're very well aware that most of our state is designated rural. This has a lot of implications for health outcomes for the communities here, and that leads us into our discussion of some of the challenges that we're going to discuss in rural health in general, but also in terms of the opioid epidemic. We're going to discuss some of those specific challenges of rural health in just a second. But first, I want to talk a little bit more about how special and how important rural America and rural Louisiana is. On the next slide, I've included some photos here that may seem familiar to some of you. So if you're like me, you've been in a lot of these presentations where we discuss rural health disparities. And a lot of it is really negative. And I'm not saying that we shouldn't talk about that because it's important. We really have to address these issues and discuss them head on if we're going to solve them. But I also want to take a moment to just highlight how beautiful, unique, and full of distinct cultural history and identity that not only the rural areas here in Louisiana are, but also across the country. I'm a little biased. I am a Monroe native, and so I have been to Poverty Point um, several times on different school trips. But even as an adult, as I went back and read some of the things about Poverty Point, I found myself still learning things. I'm sure a lot of you have been there, but I was not aware that it was designated as a U.S. National Monument, a U.S. National Historic Landmark, and a UNESCO World Heritage Site all at once. It's one of the few areas in the country that has all three of those designations. I want to read a little bit about Poverty Point just because it, as I said, it really gets to how unique some of these rural parishes and rural areas in our state are. So long ago when Stonehenge was built and Queen Nefertiti ruled Egypt, there were indigenous Americans in North Louisiana building earthen monuments. They built these hand by hand and basketful by basketful. Men and women shaped nearly 2 million cubic yards of soil into stunning landscapes, and the result was a massive 72 foot tall mound, enormous concentric half circles and related earthworks that dwarfed every other earthen monument site for about 2,200 years. So there's a lot of mystery that still surrounds Poverty Point, as we don't really know what the purpose of these structures were. We don't really know if it was a trading site. We don't know if it was a meeting point or a ceremonial center or all of those at once. What we do know is that this site was abandoned around 1100 BC, and another group of indigenous Americans added another mound to it in about 700 AD, but they only occupied a small fraction of the site and only for a brief period. And so, as I said, even though we're talking about some of the difficulties and some of the challenges in rural areas, I do want us to keep in mind tonight that rural Louisiana and the parishes that we have here has a lot to offer. And as we'll see on the next slide, as we'll see, there's a lot that comes out of our rural parishes. So I did also want to share the commodity map with you all. I'm sure some of you have seen different versions of this one. This is a description of all of the commodities like livestock, wildlife, crops, all of the different exports that Louisiana sends to other places. As most of us probably know, Louisiana is also known as the sportsman's paradise. Many of our rural parishes are home to bayous, swamps, coastal marshes, other wonderful hiking and fishing sites, all types of abundant natural resources. And as we all are probably aware, our state has a lot to offer. And so as we're thinking about some of the challenges and difficulties in the rural areas, I just want us to keep in mind that, we shouldn't count out our rural communities. They're full of hardworking and individual unique people. And they're important when it comes to Louisiana's economy and just the culture of our state. I do want to take a moment to hear from you all. I highlighted Poverty Point, but I'd be curious to know if any of you have any other special areas in mind in this state that are in rural parishes that you think of as landmarks. What do you all think?
I don't know. I don't know nothing about none of them. Um, what is the name of that? Um,
Anybody? You can also drop them in the chat if you like. As we all are probably aware, there are also an abundance of national state parks, different things all across the rural parishes. And as I said, it's just important to kind of keep in mind that our state has a lot to offer, even though it's mostly rural. You can still share them in the chat box, but we'll move on to the next slide, where we are going to talk about a few of those rural health disparities that I mentioned in the beginning. So, as I said, there are many differences between rural and urban life, including how people live their lives and how people can access healthcare. We're going to talk a lot about some of the healthcare disparities that kind of feed into some of the issues that our rural communities are having with regard to the opioid epidemic. But just keep in mind for now that rural residents often encounter barriers to healthcare that limit their ability to obtain the care that they need. What we do know is that in order for rural residents to have sufficient access, necessary and appropriate healthcare services must be available and obtainable in a timely manner. And as I mentioned, there are a few disparities that we're going to look at on the next slide that really detail the differences in lifestyle as well as healthcare. And these definitely play into the opioid epidemic as well as the coronavirus pandemic that we are all pretty much still dealing with the effects of. So according to the CDC, rural residents are more likely to be under or uninsured than their urban counterparts. They are more likely to utilize Medicaid and other federal insurance options. They are more likely to experience healthcare worker shortages and receive care from workers with less education. Rural residents receive less access to specialized care and services and have significantly higher travel times for healthcare. And about 64% of non-core or small rural counties, or parishes in our case, are persistent poverty counties compared to 22% of micropolitan or metropolitan counties, 14% for metropolitan counties. And so as we see, all of these issues kind of intersect. Poverty can feed into healthcare access and healthcare disparities, which then feeds into how people are able to access prevention, treatment, and recovery resources in terms of the opioid epidemic. On the next slide, we'll talk a little bit more about some of the other disparities in health and lifestyle, and we'll talk a little bit about how these lifestyle differences also play into this. So rural residents have lower average income, 52,000 per year as opposed to 69,000 in urban areas. What we also know is that reliable transportation to care can be a barrier for many rural residents. due to long distances, poor roads, limited availability of public transport in rural areas. As we all know, here in Louisiana, I wouldn't necessarily say that public transport is at the top of the things that we're great at. And so it's just something to keep in mind for our rural counterparts as they try to access their healthcare. Studies show that rural residents are more likely to be unemployed or underemployed, and they have less post-secondary education as well. Even though these came out before the pandemic, I would also urge us all to keep in mind that the coronavirus pandemic also has been shown to exacerbate a lot of these issues. On the next slide, we are going to talk about some of the rural lifestyle differences that I mentioned before. This is a chart from the Rural Health Information Hub, where there was a study conducted by the CDC on health-related behaviors in the differences between urban and rural counties and populations in 2013. What they've done with this study is designate 5 key health-related behaviors and then track the number of survey respondents that are incorporating these behaviors into their lives. For most of these, as you can see here, are non-core. And if you want to think a little bit bigger, maybe urban clusters, that's going to be your micropolitan areas. As you can see, most of these healthy behaviors are not being undertaken at the same rate as they are in large metropolitan centers. Just to pick a couple out, I'm looking at non-smoking. There are 83.9% of respondents in large metro centers don't smoke, as compared to 74.9% in non-core areas. So there are more people that smoke in rural areas. That goes as well as non or moderate drinking, maintaining normal body weight, meeting aerobic activity recommendations, and sufficient sleep. If we look at kind of the summary on the last row there, we will see that the people who reported 4 out of 5 of those behaviors that I just read are mostly in large metro centers. If you look at the non-core population, which is kind of interchangeable with rural for our purposes here tonight, only 27% of people are reporting that they regularly engage in 4 out of those 5 health-related behaviors. So as we can see here, lifestyle also plays into how healthcare is accessed and how the health outcomes turn out for our rural areas. So just keep in mind that there are some lifestyle differences for our rural counterparts as well. On the next slide, we're going to take a look at the map from the Rural Health Information Hub that shows where our centers are, but I do want to take a moment just to talk about the misconception that can take place when we see maps like these. So as you can see here in Louisiana, we don't really have that many urbanized areas. Remember from our definitions before, those are going to be your areas that have 50,000 or more people. We don't have a lot of those here in Louisiana. And so most of the federally qualified health centers and the clinics that are shown on this map fall outside of those. It can look like there's plenty of options and plenty of access in our rural communities when you look at maps like these. But one thing to keep in mind is that rural health centers and rural health clinics are not often offering the same services as their urban counterparts. And rural center closure is something that we also have to keep in mind as well. So I do want to share a couple of stats with you. According to the Center for Healthcare Quality and Payment Reform, more than 800 United States hospitals are either at immediate or high risk of closure. If we want to dig down into Louisiana personally, about 63% of our rural hospitals in Louisiana are in danger of closure due to financial constraints. And so what we know from that is that that can definitely impact the way that rural residents can access their health care, and that also can put an additional strain on EMS services. So one other thing, even though we're not talking specifically about some of the other intersections between rural populations, another thing for us to keep in mind tonight is that as we continue to think about cultural, ethnic, and racial minorities, a lot of the statistics that I'm reading are going to be doubly bad for our different ethnic groups. And so as these hospitals continue to close, this can place additional healthcare disparities in Black rural communities, as well as those that are Native, Indigenous, and Hispanic as well. So we're going to move to the next slide and talk a little bit more specifically about the opioid epidemic and how we got here. So first, you probably heard in other sessions the definition of opioid misuse, but I do want to take a second just to define exactly what it is. Opioid misuse refers to any use of prescription painkillers such as oxycodone, hydrocodone, codeine, and morphine, or synthetic pain relievers such as fentanyl outside of their prescribed or intended use, as well as the use of heroin. So, according to a 2019 report, 3.2% of adults in rural areas and 3.5% of adults in large metro areas reported some non-medical use of prescription opioids in 2019. To just kind of trace the opioid epidemic from the beginning and through the three waves that most people use to designate the time periods in the opioid epidemic, I think for most of us, our awareness of opioids kind of happened in the late 1990s as pharmaceutical companies began to reassure the medical community that patients would not become addicted to prescription opioid pain relievers, and in turn, doctors increased prescriptions. Some of you are probably aware of Purdue Pharma, the manufacturer of OxyContin, which I think for a lot of us was the first mainstream opioid prescription painkiller medication that we were aware of. And as we kind of know from the trials and the court cases that are taking place right now, Purdue Pharma was a large company. They had a lot of reach, they had a lot of marketing reps. And so these marketing reps were able to convince doctors that opioid painkillers were not that dangerous. By the time people really began to become aware that they were dangerous, they had a high risk of addiction, widespread diversion and misuse took place. According to the American Council on Science and Health, prescriptions for opioids tripled between 1991 and 2011. I did a little reading about that because that's only a 20-year period. And I just wanted to know, is it unusual for a medication prescription to triple in that short amount of time? And the answer is yes. When we think about other medications for other chronic illnesses, so like insulin for diabetes, high blood pressure medication, maybe even other medications for other illnesses, those rates usually hold steady with the rate of diagnosis in the population. For opioid painkillers to rise that quickly is unusual and definitely feeds into our current opioid epidemic as we know it today. So the CDC cites three waves of the opioid epidemic. First, there was that prescription opioid wave that we mentioned that was kind of started by Purdue Pharma. That led us into a rise in heroin as prescription opioid painkillers became harder to access, and different states, cities, and counties began to institute their own prescription monitoring programs. And that has led us into our current stage of the opioid epidemic, where a lot of communities are dealing with all of these problems at once. But now we also have more synthetic opioids that are available on the Black market, like fentanyl, carfentanil, and these have a very high risk of overdose. So a 2015 study from the Carsey School of Public Policy showed that rural adolescents were more likely to misuse prescription painkillers than urban adolescents. Even though this issue can be thought of as an urban or a city problem, it's just important for us to keep in mind that these issues definitely are taking place in our rural communities as well, and they can start early. As I mentioned, adolescents can also misuse prescription painkillers. A 2013 study by SAMHSA and their Center for Behavioral Health found that people who used opioids non-medically were 19 times more likely to initiate heroin use. So there's a definite link between the opioid epidemic and heroin. Heroin became more prevalent in suburban and rural areas because of its affordability and ease of access compared to prescription opioids. As I mentioned, a lot of states began to implement their own prescription monitoring programs. And so heroin, which is predominantly injected, also presents several other health risks, such as hepatitis C, HIV, and the risk of unintentional overdose. So it's just something to keep in mind as we look at more statistics about the opioid epidemic. On the next slide, we're going to look at a few national statistics before we kind of dig into Louisiana specifically. So this is the opioid epidemic by the numbers. About 70,630 people died from drug overdose in 2019. 1.6 million people had an opioid use disorder in the past year. I do want to add a caveat to that and say that, those are reported opioid use disorders. As we know, a lot of times these can also go undiagnosed or underdiagnosed. 745,000 people used heroin in the past year. And just to jump over, 50,000 of them used heroin for the first time. So that is also an indicator for us that the heroin piece of the opioid epidemic is continuing and seems to be growing. 2 million people use methamphetamines, which can also be used in conjunction with opioids and cause polysubstance use disorder. And 10.1 million people misuse prescription opioids in the past year. So these numbers are quite large. It just goes to show that this is a national problem. On the next slide, we're going to look a little bit more specifically at Louisiana as a whole. So some of you may have seen this graph before, but this is a graph of the opioid involved deaths in 2019. We will have the 2020 numbers for that once LDH releases their next report. And what we know is that our Department of Health here in Louisiana tracks both the parish of occurrence and the parish of residence, which is really useful data for those of us who are interested in the source of the opioids. What we can see here in this graph is that our rural parishes are very much overrepresented in some of the higher overdose deaths that are being reported. In particular, I'm thinking about Washington Parish, which you can see there. I work from Baton Rouge, but I'm a Monroe native. And so I've been to Washington Parish several times. And what I know from going there and talking to some of the law enforcement and the EMS officials there is that the issue is quite bad, as I'm sure a lot of you have heard in other rural parishes. So I do just want to take a moment to reiterate that, this is not a city issue. This is not an issue that is confined just to one particular area. We are dealing with this across the whole country and across the entire state. On the next slide, I do want to also take a look at some of the data that came out around during the time of the coronavirus from the Louisiana Department of Health. What they've done is made this graph to compare each month in early 2019 to its corresponding month in early 2020. What this data shows is that there were some drastic changes in the statewide rates of drug deaths as all of us were dealing with the beginning, but also I'd say maybe the peak of the pandemic. In particular, and I just want to take a moment to note here that they are counting drug deaths as a whole, but also they are separating opioid poisoning deaths and synthetic opioid poisoning deaths when they're comparing 2019 to 2020. In particular, let's take a look at May. I usually look at May and June because I believe that is when, that's when I think that the peak of the pandemic was upon us. A lot of us were really trying to figure out how to adapt our work. What we can see there is that there was an increase in May from May 2019 when you look at May 2020 from 45 opioid involved deaths to 93, which is double and a 106% increase. We can also see a drastic increase in May for synthetic opioid poisoning deaths in Louisiana from 21 to 68, which is a 223% increase. One of the things to keep in mind for this is that a lot of recovery and treatment services got disrupted as a lot of our work did. I think all of us kind of had to transition over to either working from home, moving into completely virtual spaces, and our treatment landscape had to also adapt to that, as well as the people who were relying on these resources for their recovery. And so as our data continues to come out, we're going to learn more, of course, but just keep in mind that, as I mentioned before, the coronavirus pandemic and the opioid epidemic are compounded. They basically exacerbate each other. And we should think about these things as they, as the coronavirus pandemic, wanes in some areas and continues to rise in others. But just keep in mind that, there are still a lot of challenges in the way that people can access treatment and recovery resources. And even though this particular graph that we're looking at doesn't pull out the rural data or the rural deaths that are involved in these numbers, we can assume here that this data has some dire implications for rural Louisiana and the people that live in these communities. Next slide, please. So let's talk a little bit more specifically about opioids in rural communities. As I mentioned before, this can often be perceived to be a problem of the inner city and urban areas, but we should just keep in mind that substance use and misuse have been long prevalent in rural areas. Rural adults have higher rates of use for tobacco, methamphetamines, as well as prescription drug misuse. Prescription drug misuse and heroin use has also been shown to have grown in towns of every size in the past years, including rural areas. According to HRSA, the rate of deaths from natural and semi-synthetic opioid use was higher, in rural than urban counties. And in 2018, opioids were found to be responsible for approximately 66% of drug overdose deaths across the country. What we know, I'm going to read a few things to you from the National Farm Bureau. What we know is that not only is the opioid epidemic taking place in rural communities, rural residents and rural citizens in this area can have different understandings of how the opioid epidemic looks and feels. So, according to a survey done by the National Farm Bureau, 3 out of 4 farmers, farm workers, and agricultural employees are or have been directly impacted by opioid use, either by knowing someone or having a family member who was addicted, or having taken an illegal opioid or having dealt with an addiction themselves. So that's quite a lot. 3 out of 4 farmers, farm workers, and agricultural employees, as we know, which mostly live in rural areas. 3 out of 4 farmers and agricultural workers say it is easy to obtain a large amount of prescription opioids or painkillers without a prescription in their local rural community. Only about 1 in 3 rural adults say it would be easy to access treatment for addiction to prescription drugs or heroin in their local community. And 38% of these people are confident they could find care that is either effective, covered by insurance, convenient, or affordable. I'll read that one more time just to let that sink in. Only 38% of people in these rural areas that responded to this survey are confident that they could find care that is effective, covered by their insurance, convenient, or affordable. And so, what that tells us is that rural residents are not confident that there are resources available in their local communities to help them with the opioid epidemic. But there was a bright spot in this survey that I will also share with you. 1 in 3 rural adults say there is a great deal of stigma associated with the opioid epidemic and opioid abuse in their local community, but they recognize that more public education and more public conversations can help to reduce stigma in their communities. So the bright spot there is that I think that not only are rural residents becoming more aware that this is an issue, but they also recognize that more education, more presentations and events like these, more conversations and more collaboration can certainly help to mitigate this issue in their communities. On the next slide, we'll talk a little more specifically about stigma and how that impacts the way that people can seek and find treatment. So first I'll define stigma for you. According to the Addiction Policy Forum, stigma refers to a process through which individuals are discriminated against, devalued, rejected, or excluded as a result of belonging to a socially discredited group. Addiction-related stigma prevents people who are struggling from reaching out for help and isolates families affected by this disease who fear being judged by their communities. Rural residents often report that stigma is high in their tight-knit communities and that it can be prevalent not only in the general public, but healthcare providers as well. So despite the fact that over 20.3 million people in the United States struggle with substance use, nearly half of Americans have been shown that nearly half of Americans don't think that addiction is a disease. And so it's something to keep in mind that stigma can lead to discrimination in healthcare, criminal justice, employment, child custody, housing, pretty much every area of life, stigma can come into play. And this can make it really difficult and discouraging for people to admit that they have a problem and seek out treatment. I'm going to share a chart in the next slide that just kind of touches on one of the ways that we can help reduce the stigma in our small towns. So when it comes to stigma and using person-centered language, I do want to just really stress to you all that the goal is not to police your language or to force you to be politically correct all the time. The goal is to be compassionate with people and show empathy and understanding in ways that encourage them to seek treatment or help if they need it. And so you all have probably seen these charts before, but I do want to just read through some of these terms. And just, urge all of us to try to make these small tweaks in our language to make sure that we are centering people in our language and not their condition, and that we're always acknowledging that substance use disorder and opioid use disorder are diseases. So rather than using terms like clean or dirty drug screens, we can try to use the more technical and accurate terms like in recovery or using positive drug screen. Rather than using substance abuse, we can maybe use substance use. Rather than talking about people bombing out or dropping out of treatment, we can just use the more technical term and say that they're not engaging with treatment. When words are used inappropriately to describe individuals with substance use disorder, it can not only negatively distort societal perceptions of their illness, but also feeds into stigma that can prevent individuals from coming back and continuing their recovery. So in 2014, over 22% of individuals with a substance use disorder did not seek out treatment because they felt it would have a negative impact on their employment or the way that their neighbors and their communities would view them. I just want to reiterate that the more that we're able to replace some of these more stigmatizing terms in our language, the more comfortable we can make our peers and their families to seek out help when they need it. On the next slide here, we're going to talk a little bit about how rural communities can combat these issues. Now, I do want to reiterate from the beginning of the presentation that I don't think that there are any definitive answers that work in every rural community. And I also don't think that any of these that I am listing here on this slide can work by itself. I think that each one of these feeds into the other, and each one of these is going to look different depending on what rural community is in question. So of course, rural communities can improve prevention education. We can implement population-based preventative educational programs and resources, and we know that that is a key strategy to achieving positive health outcomes in rural America. With respect to effectively addressing substance use disorder, experts have identified prevention as a critical element in curbing the crisis. As I just mentioned, we can try to combat stigma, allowing for more public attention and discussion, kind of like the presentation that we're having tonight and the others that were in this series. We can really reduce stigma and encourage people to seek treatment by making them feel more comfortable in using that person-centered language that we discussed in the slide before. We can also find ways to incorporate opioid education in existing community events, make it a one-stop shop, and integrate addiction services more so into healthcare. Also, improving collaboration. As I mentioned, our program in the epidemic prioritizes forming and supporting rural networks in these communities that span multi-sectors. So including law enforcement, including EMS, hospice care organizations, religious groups, agricultural industry associations, educators. Pretty much everyone should be at the table for these discussions. And so definitely finding ways to improve that collaboration, keep the discussion going, making sure that everyone is in the loop in these small knit communities. That can be a really helpful thing. And also, I would argue that that can be an opportunity more so than a challenge for rural communities. Because they're small, it can be a little easier to find people and invite them to the table to discuss what ways they can work together to combat the issue in their town. And lastly, what I would consider probably the most difficult and the one that's probably the most expensive here is strengthening healthcare, which is very broad. So also, most sources encourage rural leaders to explore new models for increasing access to treatment. We've all, I think, had a lot of talks about that in terms of telehealth and how virtual treatment access options can also be used. How we can grow the healthcare workforce, develop infrastructure and capacity to use technology for remote service delivery, and educate community members about treating addiction as a disease to encourage community support. So all of these things, as I mentioned, go together. They go hand in hand. Not just one of these is going to solve the issue everywhere in the country. So next slide, I'm going to show you all some resources for rural communities and opioids. And I also just want to thank you all for being a part of the conversation by joining this presentation tonight. As you probably saw, most of my sources tonight came from the Rural Health Information Hub. Whether you are just a concerned citizen or an outreach professional, I urge you to go and look through some of the information available at the Rural Health Information Hub, just because there's lots of data and statistics that can be useful for planning things, but also they have a very good list of different healthcare centers and resources that can be helpful to help you all find resources if you find that someone in your community needs them. I would also urge us all to go and look for the Rural Community Action Guide from the USDA, which addresses opioids specifically and gives some specific recommendations for how small communities can deal with this. There's also the Rural Community Opioid Response Program for the outreach professionals out there. If you're seeking funding for any initiatives, that is a great place to start. If you're looking for just general data, of course, there's the Louisiana Hope Council's website on the Louisiana Department of Health. And finally, if you are looking for reliable treatment, I urge you to visit Atlas, thetreatmentatlas.org, which is a service from Shatterproof. This is a treatment locator available in Louisiana and 5 other states. And this has been a really good resource in searching by using different search criteria to find the type of help that can be right for you or your loved one. The next slide, I'll also share some information with you all about the Louisiana Ambulance Alliance. Specifically, if you're interested in knowing more about the work of the Ambulance Alliance, I urge you to visit our website. You can see some of our network development information from our In the Epidemic program. You can see the other rural health programs that the Alliance has taken part in currently and in the past. And if you're just interested in knowing more about EMS and how EMS kind of fits into the broader landscape of healthcare here in Louisiana, you can definitely visit us online. I'll also urge you to visit intheepidemiclouisiana.org, which is where our partner, the Department of Justice, has listed a lot of general prevention info and listing a lot of resources that are in local rural communities. And I urge you to follow our In the Epidemic program on Facebook and Instagram. So in essence, I'm asking all of you to stay in touch. On the very last slide of our presentation tonight, I do want to share one of our campaigns. So this campaign from In the Epidemic Louisiana publicizes drug take-back options that are located at local pharmacies, fire departments, and law enforcement offices across the state that can be used for safe drug disposal year-round and not just on DEA Drug Take-Back Day. I also remember Yolanda in her presentation talking about how your drugs can be stored safely at home and how you can keep these things from falling into the wrong hands. If you would like to learn more information about that, you can definitely text our text line here using this information, and you will get a link directly on your phone that lists some important resources for you to learn more on how you can end drug diversion here in Louisiana. And on our very last slide, I just have my contact info. So any of you out there who would like to maybe discuss the opioid epidemic in your rural community, or just keep in touch, I urge you to keep in touch with me by email. And you can also visit both of our websites, as I mentioned before. Once again, my name is Rachel Jackson, and I'm the program coordinator for the Louisiana Ambulance Alliance. And I am really grateful to have been here tonight. Thank you all so much for your attention. I hope you all were able to learn something about rural communities and the opioid epidemic in rural areas. And I hope that all of you are empowered now to find ways to help mitigate the opioid epidemic, not only in your town, but also just in your home. So thank you all so much.
Thank you so much, Rachel, for your presentation. Excellent information. We do have some time for questions. So if you would like to unmute yourself to ask your question, you're more than welcome to, or you can type up your question in the chat. No questions? All right, well, I just want to thank everybody for attending. Again, Rachel, thank you so much for your presentation. I do want to remind everyone that there will be a recording of this session on our website at bossierlibrary.org/community conversations. Next week is our last session, so please remember to register for that session, and we'll see you next week.